Thank you, Mr. Chair. Your Excellency, Mr. Mombashora, Honorable State Minister of Health and Child Welfare, Government of Zimbabwe. Thank you also to our keynote speaker, Dr. Andres de Francisco Serpa, Team Coordinator and Special Advisor, Strategy for PMNCH, WHO, and to my fellow panelists, our good friend and partner in development, Dr. Abbas Buya, Deputy and Acting Executive Director, ICDDRB, Dr. Swarup Sarkar, and Mr. Tom Thomas. To all the distinguished guests, ambassadors, ministers, and country representatives, ladies and gentlemen, Assalamu alaikum, and good morning to everyone. I'm very pleased to be here this morning. Today I'm a representative of USAID here in Bangladesh. But our programs at USAID partner with governments around the world. I'm especially pleased to see so many countries represented here today. Many of your same countries sent representatives to the Child Survival Call to Action Summit held in Washington, D.C. Earlier this year in June of 2012, where commitments were made to ensure that children live to see their fifth birthday. Today I'm here in Bangladesh, and I want to talk to you about three things. First, I want to talk about the tremendous gains that have been achieved here in Bangladesh by the government of Bangladesh and its partners. Second, briefly talk about some of the challenges that remain in the health sector. And then finally, I'd like to talk about USAID's contributions to the partnership. With a population of over 150 million people, Bangladesh is the most densely populated country in the world, excluding city-states. Bangladesh has made tremendous strides in reducing its fertility rate from 6.3 children per woman after its independence in the 1970s to the current rate of 2.3 in 2011. And due to the high proportion of youth, Bangladesh's population area, household wealth, and educational status of the mother. Likewise, women share a disproportionate burden of poor health and often lack equal access to health information and services. For example, a male child is 34% more likely to be taken to a health provider for acute respiratory infection treatment than a female child. The Bangladesh Demographic and Health Survey of 2011 revealed that in the case of some services requiring substantial resources are efforts from the household. This gender disparity on service utilization has increased over the past 4 years. Health programs need to better target resources to populations at high risk and must consider the special needs of women and girls to reduce health equity and to reach MDG goals. USAID Bangladesh's third development objective, health status improved, under the mission's country development cooperation strategy, was designed to promote successful and sustainable programs in population health and nutrition that contribute to transforming Bangladesh into a knowledge-based, healthy, food-secure, and climate-resilient middle-income democracy. President Obama's Global Health Initiative incorporates a whole-of-government approach to strategic PHN programming and serves as a backbone for USAID's health portfolio. Under GHI, GHI helps Bangladesh to adopt and scale up proven activities to increase use of long-term family planning methods, reduce maternal, neonatal, and child mortality, improve nutritional status, and strengthen health systems. GHI has offered a platform for USAID to re-engage with the government of Bangladesh and to regain its technical leadership role among the donor community. Likewise, GHI has set the stage to foster a country-led and country-owned process in helping Bangladesh achieve its MDGs. As such, GHI directly contributes to the government of Bangladesh's Health, Population, and Nutrition Sector Development Program for 2011-2016. Under GHI, USAID is continuing its efforts to reposition family planning as a development priority and to increase the use of family planning services. USAID complements the public service delivery system by supporting a network of 325 NGO clinics linked with 8,500 satellite clinics and 6,500 community workers. This NGO network provides 6 million family planning counseling sessions in 2012 and provided 7.3 couple-year protection and accounted for 13% of modern contraceptive use in its catchment area of over 20 million people. USAID trained over 10,000 providers from the public health sector, NGOs, and private for-profit sector on long-acting, reversible contraceptives and permanent methods, enabling couples to find more durable solutions to their family planning needs. USAID also increased access to modern family planning methods by social marketing $6 million worth of subsidized family planning products through more than 220,000 private sector retailers, 1,200 NGO service delivery points, and 19 for-profit hospitals. USAID intensified its support to the Ministry of Health and Family Welfare to ensure the security of key family planning commodities. USAID provided technical assistance to the ministry to develop procurement plans for 2012 and 2013 and maintained a web-based portal to track procurement and distribution of commodities from the central to the district levels. As a result of USAID's technical assistance, the ministry was able to use over $35 million of its own funds to purchase contraceptives, reduce stockouts of contraceptives, and ensure a pipeline of family planning commodities through 2013. We've also continued to increase use of essential maternal, neonatal, and child health services in 2012. USAID programs increased access to quality integrated MNCH and family planning services through health centers and community workers. We raised awareness for healthy behaviors through community mobilization, marketed affordable health products through private outlets, and advocated for policy reforms in maternal and child health in 2012. USAID programs provided more than 1.2 million medical checkups for pregnant women, treated 2.3 million cases of child diarrhea, and reached over 3.2 million children with vitamin A supplementation. We treated 148,000 cases of childhood pneumonia, immunized 335 children, and provided us a procurement and distribution of health commodities, planning and management, monitoring and evaluation, healthcare financing, and behavior change communication. In 2012, USAID assisted the ministry to establish a procurement and logistics management cell, which resulted in improved coordination and transparency for all commodity procurements within the ministry. And likewise, USAID supported the ministry to establish program management and monitoring unit to strengthen national M&E systems. This year, for the first time ever, we became a direct contributor to the World Bank-administered multi-donor trust fund that supports Bangladesh's health priorities. In support of the GHI principle of promoting country ownership, the U.S. government's $40 million contribution over the next 5 years will directly support improved health service delivery and strengthen health systems. This year, we also increased direct support to local health systems by awarding a flagship social marketing program and new scholarship program to Bangladeshi partners. I'd like to finish by saying we recognize the strong success that the government of Bangladesh has had over the last 20 years in improving health outcomes. We're proud to be a part of that, and we praise the government for their achievements. We stand ready to support the government of Bangladesh and other partners in working towards continued improvement in child health, maternal health outcomes in Bangladesh. Thank you very much.